What I thought I would do this morning is just give you an update on a couple of the things that are highlights for us at CDC right now, but also use those to illustrate how appreciative we are of the proposed 04 budget, the President's budget, and how we're going to use those resources to further our mission. I wanted to talk first about SARS. You mentioned the severe acute respiratory syndrome. Obviously, this is taking a lot of our time and attention at CDC right now. I have a graphic here that I think can just give you the broad picture that this now is a global epidemic, potentially a global pandemic if we don't get the spread of this respiratory illness under control. We're seeing it across Asia. As of yesterday, there were 1,400 cases. We now know that it is probably highly prevalent in China. We're just getting the first data points out of China to tell us that there is ongoing transmission there in at least one of the provinces and probably more widely. But we also have seen 51 cases here in the United States. Most of the cases here have involved travelers to that part of the world, but there have been examples of spread to healthcare workers and spread to family members in close settings. At CDC, our leading hypothesis from our scientific laboratories is that this is a coronavirus. A coronavirus is a common respiratory virus, but this is a new one. We've sequenced the gene, and we know that it is not like any that we've seen before. We see it in many of the patients, and they are responding to this virus immunologically, so there's strong evidence that it is the cause of the condition. We don't have a treatment, and so our measures right now are implementing isolation and other practices to prevent spread. And what we're concentrating on in the short term is making sure that any travelers coming in from this part of the world are advised to seek medical attention if they develop a fever or any respiratory illness. So far, we've issued those alerts to about 100,000 returning travelers from this part of the world. Today, we'll be extending that to travelers coming in from Singapore and probably China. So it's a major issue, and we're doing everything we can to get the information out and get the confirmation of the cause.
Dr. Gerberding, I want to commend you and your team of virologists and epidemiologists for the work that you've been doing on this SARS issue. I know there's still a lot of questions yet to be answered, but I think we're getting answers very, very quickly, and it's better enabling us at the public health level to respond to the challenge that we face. The American people need to know that the investment that they've made in CDC over the years in a situation like this has the potential to possibly save thousands and thousands of lives. The nation was wrecked by a horrible influenza epidemic in 1918 that killed millions of people globally. Hopefully it's not going to be like that, but it certainly has the appearance that if it were left unchecked and unaddressed, and the work that our CDC has done has been very, very helpful, not only to us here in the United States, but as well really to the world community. My commendations to you and all of your employees that are working with you on this. I have a lot of technical questions about this, but some of those you and I have already covered.
Before I leave, say thank you. It's been a very instructive hearing this morning. I think the work that you're doing there is vitally important to the American public. I wish that the public knew more about what you do, and I would urge you to take advantage of media possibilities and allow people to understand the value of the Center for Disease Control in their lives. As I said it earlier, it is a well-kept secret among the general public, and yet it's an enormously important resource. Question, how many people do you have overseas? Because when I talk about it, I say, well, you have outposts throughout the world. Look on the watch to prevent things from getting here. You must have quite a few people that are stationed.
We have a couple hundred people on detail in various parts of the world, including at the World Health Organization in Geneva, but in some of the more remote areas as well. For example, we have a very, very important field station in Kenya that does a great deal of field work in malaria prevention, in HIV prevention, in diarrheal disease prevention, and so forth. And we also have a similar emerging infections program in Thailand where we have a critical mass of staff. But we we support laboratories around the world. We support epidemiology and investigation capacity around the world. And we're there. We're out there.
You're always on the lookout, if I would understand it correctly, for things that might get here and try to, if at all possible, avoid having them start out here. SARS would probably be an example, but it's here to an extent. Mad cow disease, which apparently never really took hold in the United States. And I think it's an important role that CDC plays as sort of the watchdog for all of us.
I think our scientists in the infectious disease world in particular would appreciate that you understand that we are the sentinels for global health, and we put a great deal of effort and energy into detecting emerging health events, whether they're biological or otherwise. But there are still weak links in the system. When SARS evolved in Asia, in the Guangdong province of China, which is now where we believe it probably evolved, we didn't have anybody there. We weren't part of that initial epidemic. But when it occurred in Hong Kong, we already had CDC scientists available because we'd been watching for the avian flu. Now we have scientists in Beijing, we have scientists in Hong Kong, in Hanoi, in Taiwan. So our people are there really supporting this investigation.
Well, in this day and age, we hear a lot about biological warfare or threats to the United States. It's part of why we're in Iraq, ostensibly. It seems to me that CDC has got to be on the front lines in preparing and being ready to deal with that type of thing if it were to happen.
Well, we are, I think, a very important part of Homeland Security and Homeland Defense, and I'm very proud of what CDC has accomplished over the last couple of years in terms of the evolution and taking this new responsibility in stride. But it is really being built on what has always been our core capacity, to identify health events when they emerge and investigate them, respond to them, and support the laboratory aspects of that. So it's a new job, but it's being built on some of the familiar skills that we've had for a long time, and we are doing our best. We really appreciate the support that you personally and the committee has given us. We are very lucky to have the support that we've had.
The nation's very lucky to have the Center for Disease Control. Dr. Isold, the House physician, said I should give you his regards.
Thank you.
You worked with him on the anthrax issues.
Absolutely. Thank you.